Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about the non-surgical facelift. This is one of the most common problems our patients present to us with, and they just don't like looking older prematurely, especially when you notice your jowls starting to sag and your neck starting to look a little older and crepey. And so how do we fix that without surgery? It's nice not to have big scars and the extended recovery time. And nowadays we're really fortunate to have a lot of procedures that can help accomplish that without needing to go through anesthesia and a surgical kind of procedure. First, let's just talk about a little bit in the sense of what actually happens to the aging face. So one of the issues that we're all extremely well aware of is that the sun and environmental exposure can start to weaken our collagen fibers in the skin. And so to combat that, we use sunscreen, we use good products at home like retinols and Retin-A, we use antioxidants to help protect and preserve the collagen in our skin, niacinamide, hyaluronic acid, a lot of ingredients in good skincare products that can really help us maintain our youthful appearance on the skin. Beyond that, we are also losing the fibrous connective tissue in the sense that it starts getting weaker and saggier. We're also having loss of bone and loss of fat. So those are the main components that start contributing to that look of aging and sagging. A facelift addresses that deep tissue, the fibrous connective tissue, and basically placed in that fibrous connective tissue to help tighten it, and then the excess skin gets removed. So in the office, one of the procedures we use that I think is really fantastic is called Ultherapy, and this uses focused ultrasound energy to also target that fibrous connective tissue, but without having to do any sort of invasive surgery. So you can have a dinner party in the evening, look freshened, and nobody will know that you had a major procedure. The results are seen somewhat immediately, but you will see more and more results over the next 4 months. Another procedure that works in a similar fashion is called thermage. Now, thermage delivers radio frequency energy through the skin. The difference is that with Ultherapy, we can actually see the layers of skin during treatment, and we can know exactly where that energy is being placed. And that targeted treatment really, in my opinion, makes it a lot more reproducible, a lot more consistent in terms of the results that we see. But some patients absolutely love thermage, swear by it, have had it, and have seen good results. And truly, that was the very first technology that came out in like 2002 that addressed this concern of being able to tighten the deeper layers of the skin in a non-surgical way, and then to also stimulate collagen. Other procedures that we're doing now are, for example, thread lifts. Thread lifts are fantastic. We place PDO threads usually, or PLLA threads under the skin. They stimulate collagen. Many of them have little cogs or barbs on them that actually literally suspend the tissue up, and so you get a nice immediate facelift effect. The threads eventually dissolve over 18 months, but even as they dissolve, it has stimulated new collagen, and that fibrous connective tissue, which was pulled together with that thread, kind of sticks in that position for some time. So you do get a good long-term benefit from that as well. We also love to use Sculptra and Bellafill. These are stimulatory fillers that generate your own collagen and can give you what we call a liquid facelift, because we do lose fat pockets in our face, specifically in the lateral part of the face from the temples all the way down to the jawline. And this is a really excellent place to replace volume. Also through the cheek area, when we replace volume in the upper cheek area, it helps the eyes. It also naturally lifts up the marionette lines. And I also love to fill lips. So lips can actually take like 10 years off instantly when we just add a little volume back. So those sort of things. And then of course, we also use Botox actually to achieve neck lifts. So sometimes the muscle just needs to be relaxed, and can give a beautiful neck lift. So we have a lot of different technologies on the non-invasive, minimally invasive side. We also use a procedure called FaceTite and AccuTite. So this is a minimally invasive procedure, but still not surgery. In this case, I would numb the skin and then put a little probe under the skin that is going to specifically help target that fibrous connective tissue and tighten it up. If there's a little bit of excess fat, it will kill that too in the process. We might combine it with vaser liposuction, for example, if somebody has a lot of fat in their chin. Other procedures that we can use for chin fat include cool sculpting and also Kybella. Another very important procedure in the world of the non-surgical facelift are the fractional radiofrequency devices such as Morpheus 8 or even Venus Viva, and these deliver a dose of radiofrequency energy under the skin, either through needles that penetrate or needles that just sit on top of the skin but penetrate the RF in columns through the skin. And this also helps to rejuvenate collagen and gives a nice tightening effect. Sometimes we see improvements in a single treatment, sometimes it's a series of treatments, but in either case, it really does give a very nice improvement and can be performed anywhere on the body too, of course. So these are just some of the options for a non-surgical facelift. So it's not a generic procedure, it's actually a very customized approach based on what the patient actually needs. There are other procedures such as profractional laser or resurfacing lasers that can also shrink and tighten the skin. So it depends. If you have sun damage, we may go with a procedure like that versus a procedure like Ultherapy. So everything has to be customized. This was just a very general overview, but I wanted to let you know that we have a lot of options and we can achieve some amazing non-surgical facelifts at our office. And that's probably my most favorite part of what I do. Thank you so much for watching. Do share, like, and comment on our posts. Let us know what else you'd like to hear about, and we will look forward to seeing you soon. Bye.